She was in the treatment room, the door shut, and I heard the laser going off. And she gets done, and I go in there, and I'm like, what were you lasering? She's like, oh, I was doing Brazilian on myself. I'm like, how in the hell were you doing the Brazilian? Like, for people that don't know, the hair laser machine, there's a foot pedal. So that's how I get it to pump.
So preventing bruising, we would want you to stay away from aspirin, ibuprofen, coffee, alcohol. If you don't
care. The day
care,
of or the day before? Or?
I would say a couple days before and couple days after. If you don't care about bruising,
drink it up.
Have a shot for me.
There are patients that will come back and they're like, it's my first time, or I just want to talk to him about it today and I'm not sure. There's quite a few of that, which is completely normal. My go-to response is, it's going to be better than you think and you're going to love it. It's pretty much always the same answer, and it's usually always correct. The pedicure and those little things eat your
fish.
Yeah, that's what I would like. Kind of don't want to do, but do want to do, because I heard that it like gets all that dead skin off there really good. All right, number two,
we did it.
We did the first one. We got it over with. I haven't watched it, and I probably won't.
Yeah, I don't like watching myself.
I will not watch that, but I hope you all do and love it. And we had quite a week this week, or I had quite a week. I guess I shouldn't speak for you, but I went to. We got a dog, we got a puppy, and that's been crazy still. Probably will be for a while. And then I had some girlfriends and we got together at an Airbnb in, I don't know if it's considered Buell or right outside of Hagerman, but it was, people were like, you're going to Buell for a girls' weekend? You're going to Hagerman? But we did. And it was an Airbnb there that had a geothermal pool. So you walk out of the back patio and this pool is there, and it was huge and gorgeous, and you can adjust the temperature, and the setting was gorgeous. You're kind of out in the middle of nowhere. And we had so much fun, other than I got super sick. Yeah. So we had a great time. Friday night, we went to this little bar there that they said, I think it's called Wilson's Bar. Mm-hmm. And they said it was the oldest serving bar in Idaho. 1943 is when it was established. So I don't know what it means by oldest serving bar and oldest bar. I'm not sure.
Yeah.
But anyway, that was really cool. It was really, you could tell it was built in 1943. It had a lot of charm and it was really cool. But they were telling us how there was a brothel upstairs. And not today, but at one point there was a brothel up there. Darn. So yeah, right. I was thinking, well, Sam, shoot, she should have come.
I know,
she had
right?
Get a job upstairs.
I'd get right in.
Right in there. So anyway, that was the weekend, and it was fun. Other than, like I said, I got sick on Saturday, and I was like, do I drive home by myself for 2 hours and be sick, or do I stay here and be sick? I chose to stay there, and I've just been off all week, so I'm trying to snap out of that. But here we are today, and I'm excited to be with you.
Yeah. Well, my week, we had Easter.
Mm-hmm.
That was great. Spent it with family.
That was nice.
Had my normal work week. On Thursday, yesterday, I was able to do some training. I was invited to do a MERS training. So they're the company that created Xeomin and Radius. So I was able to see a little bit of different techniques, different ways to do things. It was really great. It was great to see other injectors from the area.
You met my friend.
Yes.
Cheryl.
Yep, she was great.
If Cheryl's
she was
watching.
So nice.
Hi, Cheryl. We love you. I love you. Now she'll love you too.
Yes. Mm-hmm. So it was really nice. I really enjoy meeting other local injectors to share ideas with, share experiences with. I love learning new things and learning new techniques, always trying to make myself better. So that was the highlight of my week for sure.
Good.
I really enjoyed it. Then tomorrow is my youngest's birthday. He's turning 2.
Ethan. Little Ethan.
I know. Time flies. So just gonna hang out. The weather hasn't been so great, unfortunately. So we gotta figure something out, keep them busy, but it'll be fun. It'll be good.
Yeah. Was there quite a few people at that event?
I think there was about 8 of us, plus the people who came and trained. So, it wasn't a very big group.
Which was actually kind of nice, right? I would think.
It was nice. It was a smaller office, so it was nice.
Good.
Yeah.
Also, to mention that Sam, so how we've talked before about kind of highlighting local businesses. This week, Sam went to one that's near her, and that is Human Bean. And she picked us up drinks, and I have an Irish cream breve, and it's super good.
So my drink of choice that I always get is the Mexi Mocha Extra Sweet. Don't judge.
She seriously likes a little coffee with her sweetener.
I do. Mm-hmm. I like cream with a splash of coffee. Yeah, that's
basically what it is.
My go-to. So
yeah, so those are good. So shout out to Human Bean. Mm-hmm. Good drinks.
Yes, love it.
Thanks for getting those.
Go there a lot. So got a lot of my business.
Okay, so let's talk about some issues, or not issues, but ideas, I guess. One of them that I was thinking of that Sam had come up with on her little list of ideas was the weirdest skincare practice you want to try. So I immediately have something that comes to mind. Sam said she wasn't quite sure of what hers would be, but when I was reading through the ideas, mine was that little, I don't know what you call it, but you know when you get the pedicure and those little things eat your
fish.
Yeah, that's what I would like kind of don't want to do, but do want to do, because I heard that it like gets all that dead skin off there really good.
Yeah. So and I think it tickles maybe.
Yeah, I heard it.
I would assume.
You stick your feet. Is that local? Is there a thing locally for that?
I don't think so. I
wonder if there is. I haven't heard of it.
I haven't heard of that, but
that would be something. Would you be interested in doing that?
I think so. I might be a little ticklish. I don't know.
It's super disgusting, but I would love to get all the dead skin off. So yeah. So as far as weirdness goes, I think that was literally the first thing that came to my mind when I read that. You have it? Did you come up with something?
There's a couple of things that aren't so weird that I haven't really even tried. I think that gua sha thing.
Yes.
I want to know how to do it. Mm-hmm. I don't know. I have a bunch that we just get randomly, and I've never tried it before. So I'd like to see if that helps, lymphatic drainage and things like that.
I am actually been saving a bunch of videos off that recently because I want to find out how to do that correctly and the best way to do that. I would love to do that.
Yeah. Actually know how to do it and not just be randomly doing that on my face.
Yeah. So that's a good one. And in side note, in the hydrofacials, if you don't already know this, we do that lymphatic drainage, which is really great for people. So a lot of people will come in when they have like sinus infections too, and or getting over allergies or whatever. And we get in there and I just do that lymphatic drainage and pull it all out. And so I know that gua sha is going to work because the idea behind it's exactly what you want it to do. Just doing it accurately. And I heard it can kind of hurt when you do that with the tool. I think that's how you probably know it's working. I don't know. Isn't that how most things are? Beauty is pain kind of thing. But with the lymphatic drainage on the hydrofacial, it doesn't. So side note on that, if you're ever interested in needing a little lymphatic drainage, we can do it with your hydrofacial.
Perfect.
Yeah.
I need to get more hydrofacials done.
I need a bunch of treatments done right now. I was looking at myself the other day like, okay, yeah, it's time for microneedling, maybe an Opus, some hair laser. Yeah.
Yes. I need to get into hair laser again because
yeah,
we didn't finish.
So I don't
treatments.
Yeah, we need to start yours back up. It's so funny. Like people are like, oh, you probably get all these things done and you probably, no, honestly, I don't make the time for myself like I should. And you, like when we're there, we're working or joking or messing around. And then it's time to go and we have duties. We have kids in life. And so I don't make the time for myself as much as I should. But like I said, it is time to do that. It is time to set some time aside for myself and get some things done. Yeah. What was I going to say? Oh, that made me think of, so Dakota that used to work with me. If you guys are longtime Mountain West people, you will know that Dakota was an esthetician at our office. And I love and adore her, and she got married and moved away, and we're great friends. But anyway, this reminded me of her. So doing hair laser one day, she was in the treatment room, the door shut, and I heard the laser going off, and she gets done, and I go in there, and I'm like, what were you lasering? She's like, oh, I was doing Brazilian on myself. I'm like, how in the hell were you doing the Brazilian? Like, for people that don't know, the hair laser machine, there's a foot pedal. So that's how I get it to pump the trigger. So it's not, I think people think that maybe it's like a trigger on the wand, but it's not. It's a foot pedal. So take a minute to think about how you would do a trigger with the foot pedal and the Brazilian.
And keeping it aligned.
And you have to do it. I mean, there's a skill to it. Right. And I was just, I couldn't get it. And I still to this day, I think about it. But I was like, I'm surprised there's not like holes in the wall where the laser didn't, like, or on your leg. Not that it does that. But anyway, yeah, I go, did you get it done? She's like, no, not really. I'm like, yeah, I would think so. So I ended up doing it for her. But yeah, I think about the time that she was doing laser hair removal, which you can on like your underarm or certain areas. Your legs. Super simple. Mm-hmm. But that would be quite a tricky area to do. That would be quite a tricky area to do by yourself. So shout out to you, Dakota. Good job.
Yeah, I'm impressed. Mm-hmm. What would you tell a patient who was nervous to try Botox or Tox?
So occasionally, well, not occasionally, often, especially like on Monday when I assist Dr. John, I will take all the patients back. And there are patients that will come back and they're like, it's my first time, or I just want to talk to him about it today, and I'm not sure. There's quite a few of that, which is completely normal. My go-to response is, it's going to be better than you think, and you're going to love it. It's pretty much always the same answer, and it's usually always correct. The little pokes aren't as bad as you envision in your mind. And another thing that I always tell people too is, if maybe you leave and you have sometimes, which is common, to get a heavy brow where people feel like their eyes are super closed, even though we really can't see it, they feel like it. That's a pretty common thing when you say.
Yes.
Is that you don't have to live with that. You can come back after 2 weeks and get a little touch up with that, or talk to him or you about ways to fix that a little bit. So that's one thing. I think people think that, oh, if I have this, or if I have one brow that's high, or whatever it is that might be a little off to you, that you can adjust that. It's not something that you have to live with for 3 months, or you can. And then, next time, then mm-hmm. you to mention that. So that's the main thing too. I like to tell people, mention those things to your provider. Let them know, your injector, let them know that these are concerns, or when I've had it in the past, this has happened. Let them know you're not being nitpicky. It's something that they need to know, mm-hmm. and they can fix it and adjust it, or fix it for next time, or whatever that is. So those are usually the words of advice that I like to give.
Yeah, I feel like I get a lot of times patients saying, well, I don't want to get too much tox. I don't want to look different. It's all about learning your muscles. You can't go to different injectors because the first time was or you didn't get the outcome that you wanted, because injectors need to learn your muscles. They need to learn what works for you. And when you go to different injectors, each time you're starting over. So I say at least, a couple times
with the same
injector, get the hang of it. I always like to start my patients off on a lower dose, especially on the forehead, because they can get that heavy brow. This muscle, it's pulling down. Right. So we don't want it to feel heavy for you, but if you get too much, it's going to pull down more. So we want to try and figure that out for you. But if you go somewhere else, I can't fix that for mm-hmm. you. So it's always important to just stick it out, get to know your injector, let your injector know your muscles and what works right for you. We can always increase the dose. We can always hold back on some units wherever. So yeah.
Mm-hmm. Which then again kind of coincides with what I was saying is if you do decide to leave that injector for whatever reason, maybe you've moved or maybe it's you just didn't like that injector very well, didn't work out for whatever reason, mention those things to the new one. You're not being, what's the words, like thinking that you're snooty or this or that, or,
Right.
you talk about it. That's what you're there for. That's what you're paying your money for. That's what you want to make sure it was done correctly. So I think that's a good way a good thing to remember when you go to your injector or the same one over again. Like last time this happened or whatever. Some things that I think, and you can touch on this too, Sam, some things that I think are common, I think would be good for people to hear are, like I was saying, heavy brow. Maybe one brow is a little higher than the other one. They like to call that the Spock brow, which I had a friend that had talks done and one eyebrow was super high and she had to go get her driver's license. And literally to this day, I occasionally, I don't know what will bring it up, but it'll make me think of it because she showed me her license and one eyebrow is seriously high. And she didn't think to go correct it and had to get her driver's license taken.
It's such an easy fix too. That's such an easy fix. When you have a high brow, we just add a little more tox to that side.
And it's something that's common. It's not like your
really
injector's bad because of it. It's not this or that. You just, it's something it can happen. So I think this is a good way to talk about that. So high brow,
heavy brow.
Heavy brow. What are some other things you can think of?
Sometimes, there's technique into what we do. There's different ways that we get certain results. So we have to stay a certain length away from your eyebrow so that we don't drop your eyebrow. And in turn, that sometimes creates that Spock brow because we're not going low enough. So that's an easy fix to do.
So next time you would go lower?
We would go lower. But I don't want to do that at first. I go as low as I feel comfortable. We see how that goes. If I can go lower because you have that Spock brow, then we go a little bit lower. And it usually does the trick. A lot of times, if we don't go high enough on the forehead, you start getting wrinkles at the very top. You didn't even realize you could have wrinkles there. So we just go higher and inject tox up there.
Do you ever have to go into the scalp a little bit?
Sometimes, yeah. I do have patients that I have to go into the hairline because they just have such a strong and very large frontalis muscle in this forehead area. So yeah, you have to address all of the muscle, just like around the eyes. The muscle goes all the way around your eye. So over time, you can start getting wrinkles under the eye because that part of the muscle is becoming more dominant. This part of the muscle is turned off. So this starts working a little bit harder.
That's actually another good one. People will say, you know what, I never had this before, but now I'm getting lines down here that I noticed. And that would be why then.
Yes,
because I've heard that one too. Haven't you? Yeah.
So a technique that I do is do under eye tox. So I dilute it down. There's a special technique to it. A lot of injectors are nervous to do that because you can drop your eye and you can have that droopy eye. If it's too strong, if it's injected too deep, that kind of thing. So it is a risk. I mean, like all tox, there's a risk that it gets into a muscle that we don't intend to inject. We don't even inject. Sometimes it creeps into other muscles. So that's always a risk. But going to an injector long term so that they know your muscles, they know your anatomy, that's going to decrease that risk. And then trying things new, see if you like it. I do it a lot. I do it on myself. So I really enjoy that under eye tox. It just opens up your eye a little bit more and it looks really good.
And so then it would help with those little creases underneath the eye that you can get.
Yeah.
Another thing I would think of would be your bruising. That is common and that can happen. Again, it has nothing to do with the injector.
Right.
That can be a common thing, especially for people that tend to have a lot more vascular areas.
So bruising typically happens around the eyes. I try my hardest not to bruise you. Of course, I don't want you to leave my chair looking all bruised. So I do try my best to, take my time, use the lighting, make sure that I'm going around your vessels if I can see them. Sometimes we can't see them.
Mm-hmm.
Sometimes I don't know that I hit something until I take the needle out and you start bleeding and bruising already. And so it is a risk. I try my hardest not to. If you are really concerned about bruising, you have an event that you're going to, you just can't be bruised. We do have a machine at Mountain West Medical where it's a vein finder. So we can take a look and see where your vessels are and try and stay around them. Is it foolproof? No, but it definitely will help. So definitely bring that up to your injector. If you're really worried about bruising, we can take our time and just kind of avoid those.
What are some things that people can do prior to coming in that would help with that?
So preventing bruising, we would want you to stay away from aspirin, ibuprofen, coffee, alcohol. If you don't
care, the day of or the day before? Or?
I would say a couple days before and a couple days after. If you don't care about bruising,
drink it up.
Have a shot for me. But if that's a worry for you, if you're concerned about bruising, then I would stay away from those things. You can take arnica. Arnica helps with bruising. You can do a gel with arnica. You can take it orally. That seems to help. I have some in office, so if you do bruise, I usually put some on you.
Isn't pineapple juice one too that they say that helps?
Pineapple juice, I believe so. That will help with numbing too.
Yeah, get you or anything acidic for numbing.
Yeah.
But I thought I heard pineapple juice helped with bruising, but I'll have to look into that actually.
Yeah.
I'm pretty sure I've heard that. Any other things that can come to mind that we could let people know that could occur? Those are the main ones that come to my mind.
It really is. I mean, you have to wait the full 2 weeks before you come in just to make sure that it all settles. I would hate to put more tox in you and then all of a sudden it's too much. So waiting the full 2 weeks, and again, don't wait longer than 2 weeks because at that point, you're going to kind of be off balance. And some people don't mind coming in randomly. I want my eyes done this time. I want my forehead done next time, things like that. There's nothing wrong with that. That's totally up to you. That's your schedule. If you can make it in, it's a 15-minute appointment. That's totally fine. A lot of people actually have to come in more often for lip flips because they don't last as long. So that's not a big deal at all. But you don't want to get too much off cycle, and then some muscles will start turning on before other muscles. And so it's just better to kind of stay on track with your tox if you can.
Speaking of lip flips, that's always a fun one, I think, that people don't necessarily know about, which, like Sam was saying, only will last a certain amount of time. I think typically, 3-4 weeks, maybe?
Honestly, I always say, a month to 2 months. Sometimes it lasts longer. I feel like sometimes I still have the tox in my lip flip, and it's been a couple of months. I go to drink something and I'll be like, that was kind of difficult. I had to think extra hard on that one. But yeah, I mean, you just move your mouth so much. And a lot of times your tox in certain muscles won't last as long either. I feel like if you have a strong brow, that will kind of come back quicker. Most of the time, it's the forehead that comes back sooner. We just are so used to using our forehead to make expressions. I feel like that's the muscle that comes back sooner.
That you start seeing those lines coming back a little quicker.
And the idea, too, not many people realize, essentially, we are turning off those muscles with tox. Muscles, when you don't use them, they get weak over time. The idea is that if you're consistent with tox, you should be needing less over time. And that's kind of interesting because most of the time people think that they're going to need more. But if that's the case, then you might be becoming immune to tox, which is a very low percentage of people. But the idea...
Or the brand.
The brand, yeah, exactly. Over time, you should be needing less. And I have found that in my patients, honestly. If they've been consistent with their tox, sometimes it's usually the brow that I put less in, and not too much less, just enough that it keeps it frozen, keeps it from making that movement to create those lines. But I do find that, over time, you should need less tox.
I think that's another point to make too, is you can adjust and do different amounts for what you're wanting. Some people like that frozen look. They do not want any lines or creases. They want that look, and that's what they want.
Right.
That's what they're going for. Other people like a little bit of lines around the eyes, or they want to be able to move their forehead, or they like that expression. They want people to know when they're mad or upset or happy or whatever it is. So you can talk to your injector about that. So again, that's another thing to be open about of what you're looking for, because you don't want to leave and be disappointed. Like, oh my gosh, I am frozen. This is not what I wanted at all. Well, had you had that conversation, she would have, or he would have known what you're going for. And I feel like most of our clients are really more there for the natural look, just to help kind of ease that rough lines or whatever it is.
Soften them.
Yes, just to soften them up and not necessarily freeze them. But, if that's what you're going for, that's what you're going for. But that's a good thing to be able to know that you can talk to your injector about. And it doesn't have to be this way for
frozen.
Yes, it doesn't have to be frozen for you and everyone. It's different. Every recipe is different. Everybody comes in a little different. Some people only come and do it around their eyes and leave everything else, or vice versa, or whatever it is, or just come in for lip flips.
Absolutely. So there is a way that you can make it more natural. And of course, we're going to be using less tox, so it's not going to last as long. But if that's your goal and that's what you want, it's definitely doable. It's just not going to last as long. And obviously, it's easier to make you frozen.
Yeah, I'm sure.
It's really easy to do that. It's a little bit harder to find that natural balance. We start low. So I do a smaller dose on your forehead just to kind of see how you take it, how you like it, and we can always add more. And that's so easy. If you just remember, it's not enough, just come back in 2 weeks. We can add a little more. And then for your next treatment, we will do that full dose that we did combined, or even add a little more. It's totally easy to do. Taking away is a little harder. Obviously, we can't take it away, but once you get through that 3 months, 4 months, then we can
adjust.
We can adjust it. It's very easy to do. But for a more natural look, we start low. So you may see a big change, you may not. It's playing with it. I don't want you to go and pay more for something that you don't really like. So I'd rather start low and work our way up.
Which is a good way to do it. Yeah. To touch base again on lip flips, for those that don't know, there's an injection. There's 4 injection sites. There's 2 on each side of the lip. And what that will do is loosen, like calm this down to where it flips up that top lip. And it's a weird reaction. I wouldn't think that that's what it would do, but that's what it does. So in turn, that lip then flips up. So it's great for gummy smiles, or just to increase that little pouty kind of look. I've never had it, but I know quite a few people that come in and have it done, and they love it.
You've never had a lip flip?
I've never had a lip flip.
Interesting.
Yeah. But I will say that I know that people that get it, the lip is a sensitive area. So just be aware of that. But it's so minute, 4 little pokes that most people tolerate it. But I have heard that people are like, ooh, that kind of got you. Their eyes might water a little bit. But Most
Yes.
people love it. So gummy smile people that smile, that have that really, you can see all their gums when they smile, love it too. Because that's honestly, I feel like what it's best for. Wouldn't you agree?
Yeah, definitely. When you smile and your lip curls under, you're a good candidate for a lip flip. And that will help prevent that lip from flipping under, and it'll actually relax upwards, and you'll see more of your top lip, especially when you smile. You can't really notice most of the time. Some people you can notice when they're just
Sitting.
relaxed.
Yeah.
But most of the time you'll notice it when you smile, your gums won't show as much. So it's very nice. And especially if you're interested in lip filler, you kind of want to see what it looks like to have a fuller upper lip. It's a great way to try it. And it doesn't last forever. You might have trouble talking, drinking out of straws, drinking out of cups, pursing your lips, things like that. Some people hate it. Some people love it. Just never do it again if you don't like it. It doesn't last very long. So you can get through that phase pretty quick.
I feel like most people that didn't like it at first got used to it within like a week or so, though. It's that maybe that first initial jarring moment of like, oh, I can't do that movement like I used to, or whatever it was that they were doing. But yeah, I think for the most part, most people love it.
Yeah. I tried it once. I liked it.
Did you?
Yeah, it was nice not having to think about my lip curling under. I have to adjust my smile when I smile because I don't
that why
want
you smile
that.
so weird?
I know, yeah.
That's thanks.
Pretty
Oh,
much.
gosh, I've
That's
been
why
wondering.
I don't smile when I'm near you.
I figured it wasn't me. Had to be something to do with you.
Yeah. When I take pictures and things like that. So
Which-
it's nice not to have to think about it.
That would be a good time to do it too. If like you had photos coming up and you do feel like you wanted to kind of increase that smile, that's a good way to do it prior to an event like that or something that you're having some photos done.
All right. If you could only have 3 products, your top 3 products, skincare products, what would they be?
Some sort of moisturizing sunscreen. Probably, if I'm going to be specific, it would be the Elta MD moisturizing SPF tinted. That's my favorite one. I use it every day. So that one I love. And it's, since it's moisturizing, that would take my little lotion. Ooh, oh, the serum. The Epicutis serum is like my go-to thing nowadays.
Is it the lipid?
The lipid serum is amazing. I have rosacea and eczema and sometimes a little dermatitis, and my face is very sensitive. So that will calm it right down after a treatment, or if I'm feeling like a little flare up coming on, I'll put it on. I put it on every night, but especially like if I'm feeling those things, I'll put it on. And it is great for all of those things. And then of course, moisturizing, the hyaluronic acid, all the things that it pumps the skin with the collagen building and all of that I love. The third one, some sort of chapstick. I guess if I really had to like break it down, it'd have to be some sort of a chapstick. I'm addicted to chapstick. Lip gloss, something on my lips at all times. Those would be the 3 things. So if I had to. Yeah. You?
I think for sure sunscreen. Such a lame thing, but I have to have my sunscreen. I do like the Skin Better liquid tinted sunscreen. I really like the dewy look that it gives. It gives good coverage, so I don't have to use as much foundation after. I really like it. And I would have to say retinol. I know you don't like retinol. I love retinol.
To clarify, I like retinol for people if you can tolerate it. I just cannot tolerate it enough. And I don't like it enough to keep going with it for myself. But for other people, and it is amazing. It's great. I love retinol, just not for me.
Yeah. My retinol, it can address all skincare issues. So that's what I love about it. Gets in deep. It's like a peel every day. So I love it. I love the trio from Skin Better, the moisturizer. It just makes my skin so glowy and dewy and moisturized. Smooth. I love it. I love the look after I wash my face and I have all of my products on, and I end with trio, and it looks so good. So I'd have to say those 3 things for sure.
I'd be curious to know what other people's go-to 3 things are, especially for people. What is your skincare? Do you have many?
Oh my goodness.
I think
I have way too
I
many.
think we talked about this the other day, but you had quite a few, right?
Yes. So in the morning, I wash my face. Then I use an eye cream, a day eye cream. I use Alto Advanced, so vitamin C serum. And then I use the pigment one, Even Tone from Skin Better. So I use Even Tone. And then I use my Trio moisturizer and then sunscreen. At night, I triple cleanse. So I use the Epicutis cleansing oil to get all my makeup off. I use the Skin Better cleansing gel, the Oxygen Infusion Wash.
3.
Yes.
Woo!
I like a good deep clean. And then I use a retinol eye cream, retinol, the Even Tone again, and then my Trio. So those are my products that I use day and night. I love them. They do a good job.
They do a good job.
Yeah,
they do. I do a double cleanse. I'm not as cool as Sam and
triple cleanse.
Triple. Just a double for me. And I use the Elta MD foaming wash. That's the one I go to. I used my go-to that I like. I also do, let's see, Alto Advance serum, Trio moisturizer, and the Epicutis serum, lipid serum. And then the day, I don't always wash in the morning. I'm not always a washer in the morning. Sometimes I will, but not necessarily. And that's kind of one of those things that people are like, you either do or you don't. And I don't necessarily do that in the morning as much. But I do use the sunscreen, moisturizing sunscreen, sometimes the Epicutis serum, and that's about it.
Just sunscreen, huh?
Yeah, that's pretty much it. And the serum sometimes. Yeah. But I don't use foundation, and that Ulta MD and probably that Skin Better one that you were talking about with the tint sometimes is like, well, not sometimes. For me, it's every day. That is my little go-to foundation because it just has just enough to it to put that on. And I really like that one.
Yeah.
And it blends with their skin pretty well. So those are my go-tos.
Yep. I'm going to carry both of them. So if you're interested, we have samples.
Yeah. And always when you come in, ask us for samples. We will be more than happy to give you some samples. We want you to love stuff just as much as we do. And we want you to try it out first. Like it's not cheap. We know that. So trying it out first, seeing what you like and you don't like, and then investing in a good skincare product is the way to go.
And we carry different brands and different price points. So we'll find you something that will take care of your skin at any price point. So
that's very true. I've enjoyed it.
Yes. All right. Okay. So we're done with our second podcast. If you're not already, follow us on our Instagram page, Unfiltered Beauty Podcast. If you have any topics or questions that you want us to go over, feel free to message us and we'll try and address it at the next show.